Hi students, today we are going to discuss about acid-base disorders. In this acid-base disorders, we are having four disorders, four diseases, very important, four diseases. Two from metabolic problem, two from respiratory problem. In metabolic, we have metabolic acidosis and alkalosis. In respiratory, we have respiratory acidosis and respiratory alkalosis, right? So I am going to now discuss about the metabolic acidosis. With this, what are all the subtitles, what are all the points you have to emphasize, and finally how the compensation will occur for the disorder to rescue the disorder, right? Compensation means in your mind you have to keep two words. One is respiratory compensation, another one is renal compensation for all the four disorders. Right. What do you mean by metabolic acidosis? We already know decreased pH and decreased bicarbonate. The problem is bicarbonate deficit. Here the hydrogen ion is always increased. That leads to decreased pH, right? That is the triangle that is triad for metabolic acidosis: increased hydrogen ions, decreased pH and decreased bicarbonate. Now we are going to tell one by one what are all the causes for this metabolic acidosis, right? Acidosis means decreased pH. Metabolic component is bicarbonate, that is also decreased. In causes, we have two subtitles. One is increased acid production situations. Another one is decreased bicarbonate situations, that is excretion of bicarbonate situation. The first one is uncontrolled diabetes mellitus and starvation. In these two conditions, we are getting more number of acids, right? Increased production of acids that leads to the carbon dioxide used up for the buffering action. That is a problem. Acid production is more, but for this increased number of acids, for the buffering action, we are utilizing the available bicarbonate ions. That is why bicarbonate is decreased. Next one is lactic acidosis. This is also the same condition. While strenuous exercise or vigorous exercise, lactic acid amount is increased in muscle, that leads to lactic acidosis, right? Third one is chronic renal failure, kidney problem. Here what happens is the kidneys are not able to excrete the excess acid, so accumulation of acids. Chronic renal failure, because of the kidneys are in failure state, so they are not able to excrete the excess acids. Next one is severe diarrhea. So the logic is high loss of bicarbonate through the diarrheal fluid. And next one is renal tubular dysfunction, like renal tubular acidosis. Here also excess loss of bicarbonate in urine. Okay, so where the acid will get accumulated, where the bicarbonate will get excreted. And the next one is intestinal fistula. We are having enterocutaneous, that is skin, intestine to skin, enterovesical, bladder, intestine with the bladder, enteroenteric, intestine two places they will join and form a fistula, and then iotoenteric, intestine is attached with the aorta, that is iotoenteric. These are all the fistulas which will excrete the available fluid, so the bicarbonate and hydrogen ions are excreted. So these are all the causes for the metabolic acidosis. Okay, in metabolic acidosis, don't forget to mention about the anion gap. This is very important point for the metabolic acidosis, because with this anion gap only the clinician go for the classification for their treatment. One is high anion gap metabolic acidosis, another one is normal anion gap metabolic acidosis, right? So we know the normal level of formula, and the normal level is 15 plus or minus milliequivalents per liter. That is normal level. Anion gap means unmeasured anions, right? We are almost 85 to 95% measure the cations, but we are not able to measure the full amount of anions. That is why unmeasured anions, there is always will be some gap between this cation and anion. That is called as unmeasured anions or anion gap. Normal level is 15 plus or minus 5 millimoles per liter. So why you want to measure this anion gap? It is useful in assessing the acid-base status. Then only the clinician will go for the treatment. Second one is useful to diagnose the metabolic acidosis, either normal anion gap metabolic acidosis or high anion gap metabolic acidosis. Now we are going to look after the causes for these two, that is NAGMA and HAGMA. Normal anion gap metabolic acidosis NAGMA, high anion gap metabolic acidosis HAGMA. This is very important for your MCQ. That is why I am individually and separately giving. Metabolic acidosis with high anion gap is the causes: diabetic ketoacidosis, renal failure, lactic acidosis, some toxicity produced by methanol, paracetamol, alcohol, and some drugs like salicylates. So these are all the drugs produces toxicity. They will go for metabolic acidosis with a high anion gap. So one mnemonic they are giving is Mr. Mopley. Sorry, Dr. Mopley. D-R-M-A-P-L-E, Dr. Mopley. D-R-M-A-P-L-E, Dr. Mopley. That is D for diabetic ketoacidosis, R for renal failure, M for methanol, A for alcohol, P for paracetamol, L for lactic acidosis, and E for methanol, like that. Right? Dr. Mopley. Next one is NAGMA, that is normal anion gap acidosis, metabolic acidosis. Here, first one is renal tubular acidosis, because the kidney is not able to reabsorb the bicarbonate. Second one is drugs, that is carbonic acid inhibitor, which is used for the glaucoma-like conditions, where they inhibits the carbonic anhydrase activity in the eyes and reduces the formation of aqueous humor. It reduces the secretion in the eye in glaucoma diseases. Third one is GIT loss. Already we discussed diarrhea, pancreatitis, and intestinal fistula. These are all the causes for NAGMA and HAGMA. Don't forget to mention about these NAGMA and HAGMA in metabolic acidosis. This is your 5-mark question, repeatedly asking question. In these acid-base disorders, this is the first and foremost important short notes. Right. After these causes and clinical manifestations and anion gap types, how the disease will go for the compensation. So in compensation, the first one is lung. What the lungs will do is hyperventilation. That is to remove the excess carbon dioxide through the lungs. Right. So hyperventilation to expel the excess carbon dioxide. And the second one is kidney, increased hydrogen ions as ammonium ions. They excrete the increased amount of hydrogen ions. Sometimes these hydrogen ions excreted through kidney by hydrogen phosphate, H2PO4 in urine, right? 3 compensation I am telling. All the 3 tend to reduce the carbonic acid to keep the pH in a normal range. Our aim is, our motto is to maintain the pH in a normal range. That is why this compensation will occur, right? That's all about metabolic acidosis.